The anterior cruciate ligament is situated in the knee. It is one of the four main ligaments within the knee that connect the femur to the tibia. As you can see, the ACL runs diagonally in the middle of the knee, preventing the tibia from sliding out in front of the femur, and also provides stability to the knee. When this ligament is ruptured or torn, it causes instability in the knee, which also causes damage to the other knee ligaments. ACL tears happen mostly during sports or physical activities. Basketball, football, soccer, and skiing are common sports linked to ACL tears since it consists a lot of changing directions, jumping, landing, and pivoting. It can also happen in car accidents, falls, work-related injuries, rough play, and etc. In sports, the injury happens 80% of the time by non-contact actions such as pivoting or landing from a jump. The ACL sprain and tears happens when the tibia and femur twist in different directions while carrying the whole body weight. It can also occur while quickly stopping any movement, changing direction while running, landing from a jump, turning, and/or overextending the knee joint. Other times, it may occur during a tackle in football, or when you get hit very hard on the side of the knee during collisions and direct contact with another player or object during games. The symptoms after this type of injury is that one can hear a popping sound at the time of the injury, knee swelling within 6 hours of injury, the knee feels unstable or seems to give away when using it, and of course a lot of pain, especially when putting weight on the knee. Approximately 50% of the ACL injuries occur in combination with damage to the meniscus, articular cartilage, or other ligaments. Many studies show that female athletes have higher risk of having an ACL injury than male athletes in certain sports. They are around 5 to 10 times more likely than men to experience this injury. It is still uncertain why, but some theories include differences in anatomy, knee alignment, muscle strength, and neuromuscular factors. For this type of injury, the ligament may either be partially torn or completely torn. In the case of partially torn, depending on the degree of the tear, an athlete can let it recover by itself while following treatment to return a few months after the injury. The athlete would need to do progressive physical therapy and rehabilitation, which can restore the knee to a condition close to its pre-injury state and educate the patient on how to prevent instability. If the degree of a partial tear is too high, which in most cases are, the athlete may need to get operated. In the case of a complete torn, the athlete will need to get operated in order to play sports. Complete ACL ruptures have a much less favorable outcome. After a complete ACL tear, some patients are unable to participate in cutting or pivoting type sports, while others have instability during even normal activities such as walking. There are some rare people who can participate in sports without any symptoms of instability. This variability is related to the severity of the original knee injury, as well as the physical demands of the patient. Patients treated with surgical reconstruction of the ACL have long-term success rates of 82% to 95%. After the operation, the patient needs to do physiotherapy and follow a therapist's orders and exercises starting from day one. This rehabilitation process is a very long one for sports injuries. It can take from 6 to 9 months, and this varies from person to person. In order for the physiotherapist to give the okay to the patient to go back to the game, the muscle strength, jumping, and stability must be equal for both legs, or at least within 10% difference. When returning to play, the athlete needs to wear a knee brace in order to avoid another injury. The anterior cruciate ligament is one of the most commonly injured ligaments of the knee. The incidence of ACL injuries is currently estimated at 200,000 every year, with 100,000 ACL operations performed each year. My basketball teammate Cynthia Berge, who plays in the St. Lawrence team, got injured last summer and only got operated in February. As you can notice, it takes a long time to get an appointment in Quebec City for this type of operation. These are pictures of her knee after the operation. As you can see, her right knee is swollen and has a horizontal scar. I myself got hurt in February last year and was operated last summer in July. I was able to play sports again in January this year. meaning that my rehabilitation process was 6.5 months long. These are pictures of my knee a few weeks after my operation. As you can see, I have staples on my scars, whereas Cynthia had melting stitches, which is more common these days. There is a lot of knee swelling and a few bruises on the side of the leg. The ACL injury is a very tough one for an athlete, since they are painful beyond tolerance, takes months to a year of rehab to recover completely, and it always leaves a lingering doubt in their mind if their knee will ever be the same. It takes resilience and mental toughness. One must be careful to not return to the game too early, since it could worsen the situation and injure themselves again, requiring to go through the whole process again. Some athletes return to the game in great shape and ready to perform. Others have more difficulty and may return less good than before the injury.